Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you. Good afternoon. I hope families are enjoying a safe and pleasant March break this week. As we mark a year of living through this pandemic, I want to thank all Nova Scotians for the resolve you have shown us through getting through this year. We continue to see low case numbers, and we know that it's because of the care each and every one of us has taken to follow health protocol and directives and to look out for each other. Since our last briefing on Friday, March 12th, we have announced 7 new cases of COVID-19, which includes the 2 cases that we're reporting today, both in the Central Zone. One is a close contact of a previously reported case, and the other is under investigation. Our labs completed 1,646 tests yesterday. In total, we have 17 active cases of COVID-19 in Nova Scotia, with 2 people in hospital in the ICU. The National Microbiology Lab confirmed 4 more variant cases, and Dr. Strang will be speaking to those. It's shaping up to be another busy week on the vaccine front. This week, the remaining 2 First Nation clinics have started, and another pharmacy prototype clinic has come online as well. There are also 3 community clinics vaccinating Nova Scotians over the age of 80. Next week, the final 3 community clinics come online for a total of 10. Yesterday, we opened booking appointments for those over the age of 80 born between May 1st and August 31st. Those born between January to April can also continue to book if they haven't done so already. As of Monday night, all community clinic appointments for this week are booked. In fact, almost all of the 13,000 appointments we opened for March are booked. But if you didn't get one, don't worry, more will be coming online as we get more vaccine. There was a big jump in appointments this weekend. We went from just under 200 booked on Friday to almost 5,500 appointments booked through the weekend into Monday evening. And then there was almost 7,000 appointments booked between last night and this morning. As you know, as of 7 a.m. this morning, those who are age 63 and 64 could start booking appointments for the 13,000 doses of AstraZeneca that will be available at the 25 pharmacies and doctors' offices across the province. As of an hour ago, nearly 6,000 of those appointments have been booked. I'm also very pleased to tell you that we'll be providing vaccine early April to about 300 people in the Halifax area who are in the homeless shelters. We will also offer vaccine to those who work and volunteer in these shelters. I want to thank the Mobile Outreach Street Health Team at the North End Community Health Centre for their partnership and willingness to help out. Once again, community partnerships are proving to be critical to getting this job done. Homeless shelters were initially included in Phase 2 of our rollout, but have been moved ahead given they are a vulnerable group who are more at risk. We also know that these individuals use shelters more in colder months, and it will be easier for them to access the vaccine. We're also trying a new delivery method with shelters, a mobile van. Mobile clinic options will be a key piece of our vaccine delivery program moving forward. It's been said before, but I'll say it again. Good public health policy is good economic policy. And Nova Scotia is a prime example of that. Last Friday, the latest employment statistics were released, and they have highlighted some encouraging news for our economic recovery. At a time when many jurisdictions are facing high levels of COVID-19 and feeling the economic pressure because of public health restrictions, we could all use some good news. Nova Scotia's employment in February was the closest among all provinces, returning to pre-pandemic levels. Employment numbers and the labour force both increased to levels very close to where they were 1 year ago. And we learned that employment among women also increased again and is now above pre-pandemic levels. These results show us how Nova Scotians' resilience and our desire to pull together to support one another and our local businesses has been making a difference. It shows us how businesses are innovating, adapting, and finding new ways to stay connected to their communities and who the customers who have contributed to that. Employment stats are not the full picture. Many workers in the hospitality and accommodation sectors still face uncertainty. Yet I am still encouraged because I know we have what it takes to beat this thing, to recover and shape a new future. Our government will continue to work closely with public health. If we will all continue to do our part and follow the measures that public health and Dr. Strang have recommended, we will get through this together. So continue to stay your distance, wash your hands, and wear a mask. Thank you. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Today we are announcing 4 new variant cases confirmed by the National Microbiology Lab, 2 of the UK strain and 2 South African. This brings the total number of cases of the UK variant in Nova Scotia to 13 and the South Africa variant to 10. One of the UK variants is in Central Zone and the other is in Western Zone, and both are directly linked to international travel. Both South African variant cases are in Central Zone and are linked to previously reported cases of this variant strain. At this time, there is no evidence of community spread from these variant cases, which is good news, along with the fact that our overall case numbers are staying low and stable. Low case numbers mean we need to watch out for complacency, however. While Nova Scotia remains one of the safest places to be right now, the virus could make a comeback very quickly and unexpectedly if we're not careful. So while we celebrate low case numbers, we cannot forget how important the public health measures continue to be. Washing our hands, wearing a mask, especially when we're in indoor public places where it's required, keeping our distance, socializing with a consistent group of 10 people, getting tested even if you have only one mild symptom, and quarantining for 14 days if you've traveled outside of Nova Scotia. I know it's March break and tomorrow is St. Patrick's Day. Like all holidays and special events over the past year, these too will need to be different. So have fun, enjoy yourself, but do it safely so that our case numbers can remain low. The Premier mentioned that today booking opened for 63 and 64-year-olds at 25 community pharmacies and doctors' offices, helping to deliver our first doses of AstraZeneca, and that those immunization will begin next week. I'm very pleased that so many people have already booked their appointments in just a few hours. As the Premier said, over 6,000 as of about an hour ago in our first day of booking. Just this morning, the National Advisory Council on Immunization, NACI, expanded its recommendation for the use of the AstraZeneca vaccine to people 65 years of age and over. They have previously recommended for anyone under the age of 65. We will need to consider what this news means for our vaccine rollout. But it's important to note that NACI continues to recommend that those at higher risk of severe illness and death and those with highest risk of exposure to COVID-19 should preferentially receive the mRNA vaccines, Pfizer and Moderna. You may also have heard the news that several European countries suspended the use of AstraZeneca vaccine as a precaution. I understand that this may be concerning, but there are a few important things that I'd like to highlight for people. First of all, none of the batches of the AstraZeneca vaccine that are under investigation in Europe have been shipped to Canada or the United States. We also don't know that to date there have been no reports of serious adverse events related to the AstraZeneca vaccine being used in Canada. We also know that at this time there is no evidence that the adverse events being experienced in Europe are caused by the vaccine. The actions being taken by these countries demonstrate that there is a robust vaccine safety processes that are in place. And I know that Health Canada and the Public Health Agency of Canada are monitoring the situation carefully. There's an announcement coming from a European medicine body tomorrow, and that we will be watching that closely and be informed by our federal colleagues. And we will be advised very quickly by those federal agencies if anything needs to change in Canada. The Premier talked earlier about our plan to provide vaccines for those who use, work, or volunteer in homeless shelters in Halifax. The Mobile Outreach Street Health team at the North End Community Health Centre, along with Central Zone Public Health, will work with shelters and are targeting the first week of April to start vaccinating. I want to thank both these teams for their work to make this happen. People in the shelters will get their first dose, and then we will work with the organizations to make sure that everyone gets a chance for a second dose in 4 months. The delivery method for shelters is an important and innovative development. This is the first time we will be using a mobile vaccine clinic option. And these mobile clinics are the final piece in our vaccine delivery puzzle, along with healthcare worker clinics, long-term care clinics, community clinics, pharmacy and doctor's office clinics. These mobile units will help us reach very specific groups in more accessible ways. And we will, once we have worked through the shelters and learn from how we use those effectively in the shelters, we'll be looking at how we use them for other specific populations where access is a significant issue in the weeks and months ahead. In closing today, I want to talk about myths and information. There is so much more information out there, and I know that many people struggle to really figure out what is accurate and what they should be believing. When it comes to deciding whether to get the vaccine or not, inaccurate information can literally put your life or someone else's at risk. If you're ever in doubt, go to a credible government website. The provincial government coronavirus website is a source of truth. The Public Health Agency of Canada is another source of truth, or CDC Atlanta in the United States have lots of very good information. But I want to address one common myth today, that you do not need to wear a mask, keep physical distance, and follow other public health protocols after you get vaccinated. The fact is that for now, Nova Scotians will need to continue to do all these things even after they receive vaccine, and that's for two reasons. First, people don't immediately become immune after getting vaccinated. It takes time, about 2 weeks, to build up the antibodies that will give you protection from the virus. And second, although we know that vaccines are highly effective in preventing symptomatic COVID-19, we are not yet sure whether vaccinated people can spread the virus to others when they don't have any symptoms. That means we have to keep following all the public health measures to protect friends, family, and others in our communities who aren't yet vaccinated. We are seeing evidence now that shows vaccines can prevent asymptomatic spread, but it is preliminary and early evidence. We will be monitoring this along with our public health colleagues across the country. We hopefully will be able to change this advice sometime in the near future, but for now, until we get better evidence, even if you're vaccinated, you have to follow all the public health protocols. Christy.
Thank you, Dr. Strang. We'll start with questions in the room and on the phone. In the amount of time that we have allotted today, we'll do one question and one follow-up, starting with Shayna Luck with CBC.
Good afternoon. Dr. Strang, we heard that there was an error, a problem with the booking website this morning. Even we started getting some calls. Given that vaccines are starting to ramp up soon, we'll be getting 50,000 next week. How can we be sure that everything is working well in order to book and roll that out?
I'm aware of those issues. They were corrected within an hour or less than 2 hours. So I think every time we use these, there's always, even though there's a lot of work going on, I know over the weekend testing this out, there's always some things that we may not be aware of. But the fact that we identified the issue early, was corrected within a couple of hours. We now have 6,000 people that have used that today already to book their appointment. So these are complex, in IT kind of issues and solutions that we put in place. There's always going to be little errors that happen, but the fact that we have a robust process to identify and correct the errors early should give people confidence. 6,000 people have used that today to make an appointment. I think that's a very strong signal of how well it works.
We'll have you follow up, Shayna.
We are going to get quite a lot more vaccines in the coming weeks, though. Are we ready for that number, say 50,000 a week?
Absolutely. That's why as we've talked about, and you'll see us talking more about, we are just starting to move from our hospital and long-term care facility clinics. We have a number, we're going to significantly grow the number of Community clinics, we've done the prototyping for 80+. We've had prototypes in our pharmacy clinics. We're now learning as we roll out the AstraZeneca in pharmacies and doctors' offices. We're adding on the mobile unit. So you'll see a significant growth, and we'll have more details to come in the next week or two, and the number and the location of especially pharmacy and physician clinics across the province. That we're well aware of the amount of vaccine we're expected to get, and we're building a program that will be able to rapidly deliver that vaccine once we start to get those increased amounts.
Next question will go to Tim Biscay with the Halifax Examiner.
Excuse me. Premier, you said last time we talked that you'd have some information about the Atlantic bubble. You were going to have some conversation. Can you update us on that?
That's actually tomorrow on Wednesday that we're having that conversation, and Dr. Strang and I talk every day about that and just looking at New Brunswick's numbers, and they're continuing to stay low, so I stay optimistic that we'll be able to do something soon.
And Dr. Strang, can you give us some idea of what the AstraZeneca situation is in terms of delivery? My understanding was that the first batch was through April 2nd. Are there more batches lined up, and when will you make the decision about the over 65?
So two things. We know we've got 13,000 doses starting to be delivered next Monday. It has to be used by April 2nd. We've already got half of that, almost 6,000, accounted for. So we expect we'll use that. We certainly have indications we're going to get more AstraZeneca vaccine in the weeks ahead, but no final confirmation of that. We've just received the information today about the NACI, so we'll be looking at that. But as I said, we have to look for, even though NACI removed the age limitation, on one hand, they also said that preferentially for people who are at higher risk, we should still be using, if possible, the mRNA vaccines, Moderna and Pfizer. So we have to look at that. I have a conversation tomorrow morning with my team about how we move forward with this new information.
Next question will go to Natasha Pace with CTV.
Thank you. Dr. Strang, I know you addressed that there were some concerns with the booking process today. Are you concerned the trouble with the process to book an appointment could discourage people from actually getting a shot?
So I hope people have a little bit more patience. And yeah, there were some people frustrated very first thing this morning, but again, that was corrected very quickly, and we now have 6,000 people who have successfully used that. So I hope people can see that actually the program works, and when we detect an issue, we correct it. We had some problems with the 80+ the very first day. We corrected it. We had some minor problems today that we rapidly corrected. So we have a robust process or program that people can see that it actually works. We've had lots of people, 80+ now, successfully booking their appointments through that process. Now people booking the AstraZeneca.
Go ahead with your follow-up, Natasha.
Thank you. Premier, I know you spoke about the maritime bubble and how you have a meeting tomorrow with the premiers of New Brunswick and PEI. Is there any thought to speaking with the Premier of Newfoundland, or have talks been underway about potentially an Atlantic bubble at some point this summer?
No, it hasn't been contemplated as of yet. I understand the importance of it, and that's where we were some time ago, but that hasn't been brought forward. From our public health team, they haven't discussed that opportunity. So right now, we're focused solely on the maritime region, and then in the future, if things change, then we'll be looking at Newfoundland. And they haven't reached out to me either.
Next question.
Sure, you can go ahead.
So we've talked about that with the 4 Atlantic Chief MOHs. Talking my colleague, Dr. Fitzgerald in Newfoundland, they recognize that they're several weeks behind in terms of their recovery from their outbreak, and that really we're all in agreement that we need to start the conversation with potentially a maritime bubble, and then look at how, when the time is right, to adding Newfoundland to expand that to an Atlantic bubble.
Next question will go to Alicia Draus with Global.
Thank you. Originally, it was indicated that all 80-year-olds would be able to get their vaccination in March, or at least very, very early April. But so far, those who are born between, I think, August and December haven't even been able to register, and all the appointments are already gone. So I'm just wondering when those individuals will be able to register and when they'll be able to get their shots.
Very soon. We'll be talking about this in the next few days ahead. It's still only the middle of March.
Follow-up, Alicia.
And just in terms of community clinics for the African Nova Scotian communities, I know that there's been some discussion in regards to that, so I'm just wondering if you can give an update.
So we're still working with those communities on some final details. They need to be the first to know when we confirm things and finalize things. Again, we're going to have a lot more in a number of places around vaccines in the coming days. We'll be able to finalize and then communicate to Nova Scotians.
Next question will go to Danielle Edwards with the Canadian Press.
Hi, I think this question is probably best directed to Dr. Strang, but I wanted to ask why Nova Scotia was proceeding with administering AstraZeneca while some jurisdictions in Europe have paused the rollout and are waiting for WHO analysis of blood clot incidents.
I covered that in my remarks. I mean, nobody in North America, the UK has not put it on hold. No other provinces are doing that. We've had a number of discussions at the federal, provincial, territorial tables I sit at. People who have expertise in this are looking at this. Really, what they're seeing is they picked up a very slight signal of rates of what are called thrombotic events. People received AstraZeneca, but the rates of those events aren't any more than you'd see if you took a large number of people and just watch them for a period of time. So there's nothing that would actually suggest that the AstraZeneca vaccine is increasing the risk of these events. There's nothing that would suggest that it's the vaccine that's causing these events. There's just been an association that these countries are being very cautious, but we don't even have that exact same lot of vaccine or batch of vaccine here in North America. So there's nothing that would really suggest that we need to do anything other than to proceed with our AstraZeneca program and watch how things evolve very carefully and get more information from the European context.
Go ahead with your follow-up, Danielle.
Dr. Strang, you said recently that you believe Nova Scotia would be delayed in its vaccine rollout if vaccinations were provided to people with illnesses like cancer and who are undergoing chemotherapy. Can you talk about how much of a delay would be caused by providing the vaccine to people with complex illnesses, and what would actually cause the delay?
So, two things. It would slow things down. So, what it takes when you have to take, whether it's an occupation group or a group with a specific medical condition, what people may not realize is how you actually get them involved in an online registration process. How do you validate that they are this occupation or have this medical condition? And you're doing that multiple times. What that does is actually slows down your ability to get people into clinics. And it slows it down by a number of weeks. So we're saying to folks that the best way to get as many Nova Scotians immunized as quickly as possible, which is the goal that I have as looking at what's best for the whole population and what builds the greatest level of protection for everybody as quickly as possible, is to move people through the most efficient vaccine program possible. What it means is somebody who is at a high-risk condition, they may be delayed for a few weeks if we follow an age-based approach. If we follow a different approach, it may mean that much larger numbers of people are delayed for more weeks. So ultimately, it's the choice about what is the best for the entire population. And by having other people immunized, we're indirectly protecting those people while they're waiting for their chance to get vaccinated as well.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. A question for Dr. Strang. I'm wondering how the province intends to use vaccines that rely on COVID antibodies on people who have already had COVID-19. I've heard questions about if MRA vaccines might be redundant on those who've already had the virus and already have antibodies in their system. Can you help us understand that?
So that's an area of more research, and discussion at a national level. So far, the recommendation from NACI and other vaccine experts is that even if people have had an infection with COVID, a documented infection, they still should be vaccinated. That may change over time, or maybe it means that it's that they only need one dose of vaccine. But we have vaccine experts who are looking at that and looking at the research that's evolving.
Go ahead with your follow-up, Lindsay.
Thank you. And for the Premier, I understand the meeting with the Maritime premiers is Wednesday to discuss this bubble, and you're hoping for a spring opening. I'm wondering how quickly this could happen following your meeting tomorrow.
That's tough to speculate, Lindsay. I think that the conversation is needed right now because our cases in all three provinces have declined substantively, especially watching New Brunswick come down to what their yellow level is. So whenever that happens, we start to look at our own cases, and that's when the discussion, I prompted the discussion, and I'm looking forward to that and looking forward to how we continue to manage our restrictions here in our province.
Next question will go to John McPhee with the Herald.
Thank you. This is a question for Dr. Strang. We've heard concerns from a couple in Annapolis County who have to drive 2 hours to get to a COVID-19 vaccination center. They can't deal with that long a drive. I'm just wondering what your advice would be for people in this position.
So to be patient, we will get more. We are increasing the number of clinics that we're going to have, which would increase accessibility across the province. Even as we add those in, we're also building in the capacity that people will be able to, with a community transportation network, get a ride to a clinic if necessary, as we build additional clinics in. So, people can get support to actually get to a clinic. And the last piece is that if people truly are housebound and we need to bring vaccine to those households or those individuals, we will do that. That's going to be later on in our vaccine program because our focus right now has to be focused on where we can immunize large numbers of people in a very timely manner. But we will get to ultimately to household people with more of a home care type of model if necessary. So we're aware of different challenges around accessibility and travel, and we're building in solutions for those as we grow our vaccine program.
Go ahead with your follow-up, John.
Thank you. This is again for Dr. Strang. When you look at the gender breakdown for Nova Scotians under 69 who have been vaccinated, it appears that a lot more women have gotten their shot. If I'm reading the charts correctly, it's 15,000 compared to about, 15,000 women compared to about 5,000 men. Can you confirm that disparity and tell us why that might be the case?
I haven't seen the exact numbers, but that's simply a reflection of we're being a strong focus on healthcare workers, and the majority of our healthcare workers, especially in long-term care, are females. That's the reason for that.
Next question will go to Victoria Walton with the Coast.
Thanks. This question is for the Premier. A few weeks ago, you announced the new small business real property tax rebate program. Applications are set to open mid-March, but I'm just wondering if you have a date yet for when those will open. And also, just if you could talk about it some more, give some more details about, it's either $1,000 or, I believe, 50% of property taxes. Will that work out for most people to be more than $1,000, hopefully?
Yeah, sorry, I don't have the date, the live date in front of me, but we did a calculation on where we thought it would help them the most, and it's about cash flow in their pockets, and we tried to look at the most fair calculation. We know they struggle for utility bills, their other fixed costs that they would have when they were shut down, or currently with the restrictions being what they are. So we know that they're losing revenue, and the way that we thought was the most fair is to look at the property tax, but we know that they'll be using it for other means. It's just cash flow in their pocket, and we looked at the 50% figure with both of them, and the restaurants, the spas, the hair salons, and then our recent announcement was for motels, hotels that have been hit just as hard. So that's out there, and we just had the minimum figure of $1,000 just in case it wasn't a meaningful amount when you did that calculation.
Go ahead with your follow-up, Victoria.
Thanks. And this question is for Dr. Strang. We talked about variant cases, some new variant cases directly related to travel. I'm not sure how much you can reveal without, giving away private information. But where are these travelers picking up the variant cases? Or is it in the U.S., Europe, Asia? Can you be a little more specific?
Well, they're international travel. The variants are spread globally. So I don't, it's international travel. Many parts of the world are at risk for that. So we're not going to go beyond that level of detail. It really is not substantive to our investigation. We just know that it proves why a 14-day quarantine for international travelers is necessary.
Next question will go to Elizabeth McSheffrey with Global.
Thank you. My questions are for the Premier. There was a protest outside Province House today, led in part by a hunger striker who hasn't eaten in 9 days. They're demanding a moratorium on Crown land clear-cut logging until key recommendations of the Leahy report are implemented, noting that, the new Biodiversity Act wouldn't come into effect until October. Can you respond to allegations that your government's not acting quickly enough with enough urgency to protect forests and mainland moose habitat?
Certainly, I think it's really important that we progress with the implementation of that report. We've made some timeline commitments with that. The Crown Lands Act actually speaks to the need to look at private lands more and more for supply of wood for our sawmills across the province, and our government supports the industry, but we also want to see healthier forests for the long run. I think that's in everyone's interest. So I appreciate the work that everyone's doing to support those efforts, and I hope that we can all come together to support an act like the Biodiversity Act. There are some myths out there that it would impact farming and mining and forestry, which is just inaccurate. So I think cooler heads will prevail, and we'll get together to make sure that we move forward in a way that everybody can respect, because biodiversity is very important. And I appreciate the concerns brought forward by Nova Scotians, and that's why we're moving forward with legislation. And we've been moving forward on this report for some time, and I've committed to accelerating those efforts.
Go ahead with your follow-up, Elizabeth.
Thank you, Premier. And again, the young man's been on a hunger strike for 9 days now, says he hasn't eaten in 9 days. Will you commit to meet with him to hear his concerns, or will you ask anyone in your government to do so, before he ends up in the hospital?
So I continue to meet with stakeholders, and now the Minister of Lands and Forestry has a committee put together that represents views very well from the environment side and from the industry side. It's a really important issue, and I respect the need for people to voice their concerns in a respectful way, and that's going to continue on some of these challenging issues. But you will see progress on this file, and the young gentleman that's bringing these issues forward. I thank him for those efforts.
Next question will go to Jean Laroche with CBC.
Good afternoon. My question is also for the Premier. This has to do with a news release that was issued by your government about an hour before this COVID update. It has to do with an $800 grant for students with permanent disabilities. I'm wondering, given the fact that the classes, university classes end in about 3 weeks and community college classes end in about 5 weeks, why is this grant coming now?
So I haven't looked at the details of that exact program, Jean, but when we have support programs out there, they're to fill needs, and so obviously this demographic has been challenged, and now is the time that we start to support people. There's businesses support that's gone out. Individuals need support too.
Go ahead with your follow-up, Sean.
Dr. Strang, given the fact that we're about to ramp up significantly on the vaccine delivery front, what would you say would be the most limiting factor in getting vaccines out to Nova Scotians at this particular stage?
I think our biggest challenge is going to be, are we going to get the vaccine? The federal government can confirm deliveries just in 2-week blocks. Beyond the 2 weeks, everything we hear, we have projections about the vaccine we're going to get, but it's not finalized. So everything we built on, including our end goal statement, which is that we expect that every Nova Scotian who wants to get a vaccine will have their first dose by end of June. That is ultimately based on the premise that we're going to get the supply of vaccine that's projected to us from the federal government. That's our biggest, that's going to be our biggest, I'm very confident we'll get it, but it is going to be the biggest uncertainty that we have to deal with.
We have time to go back to the room for one more question and one more follow-up, starting with Shayna Luck with CBC.
Just to follow on that idea, Dr. Strang, what would give you the certainty to say we've seen the end of, the confidence, I guess, to say we've seen the end of supply uncertainty?
Well, if we could get guarantees for the, longer term beyond the 2 weeks, but I get, the federal government, it can only deal with what they're getting with certainty from the manufacturers. A longer runway, if you will, of guaranteed supply would give us confidence. But so far, we've had a couple of blips in Pfizer and Moderna, but so far the projections that we've been given and then the promised amounts have come true. So we have every confidence that what we're going to get, what's been, from the federal government, will be delivered in the time frame that it's going to be delivered.
Go ahead with your follow-up, Sheena.
I think that's it for me. Thank you.
Moving on to Tim Biscay with the Halifax Examiner.
On the vaccine rollout, I'm sure you've seen people complaining and pointing at numbers. We're going to be getting 80,000 a week, ballpark, vaccine. What would be a realistic number for the timeline to get those vaccines from being received out into people? Will we see numbers like 160 or 240,000 not in possession but not administered yet, or you understand what I'm trying to get at?
Right now we have a bit of a lag because we've got some second dose that's held back, and people that were already had an appointment for a second dose, we're gonna hold ourselves to the promise in terms of when they gave a consent for the vaccine. So we have a few more weeks of holding back second dose, but in the next few weeks we're gonna start to put every vaccine we get is gonna be delivered as a first dose of vaccine, and will be no more holdback. And we're building a program that we know the estimates or what the projections of the weekly amounts of vaccine we're going to get. And so we're building a program that if we get, let's say, the first week in April, we're going to get X amount of vaccine. We will use that vaccine by the second week in April. So we're building our program. Whatever we get in 1 week will be delivered by the next week. So there won't be vaccine sitting around. It'll be delivered in a very timely manner.
Tim, do you have a follow-up?
Just to follow up on that, and I hear you, but there's an awful lot of confusion or suspicion or just anger at this, that people are saying, look, if I subtract out the second doses that Nova Scotia has, there's still 40,000 that are on hand, and what I'm hearing you say is it will take up to 14 days for any dose.
So let's use the number of 40,000 used. That 40,000 that people are saying, that's what's going into arms this week. People are forgetting that we are actively immunizing people every day. So we have to have a bunch of vaccine at the start of the week that we roll out and deliver to clinics across the province. And by the end of the week, it will be delivered. So we're always, the vaccine we get in 1 week it has to come in centrally and then gets distributed out to vaccine clinics and is used throughout that week and into the next week. So there's always going to be a chunk of vaccine. If people are looking at how much vaccine in the province today, what they're missing is a portion of that is the vaccine that's going into arms today, tomorrow, Thursday, Friday.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you. This is our March break week. Of course, it's a holiday for our school kids right across the province, but as you can see from today's numbers, COVID doesn't take a holiday. Our cases still remain very low, but the virus is still within our borders. We are still seeing a couple of new cases every few days. So let's make sure that we keep those counts low and stay safe during this week by practicing what we've been doing so well over the last year, good public health. I know I sound like a broken record sometimes, but keep staying your distance, wash your hands, and wear a mask. Thank you.